Have you ever felt an unusual sensation in your body and wondered if it meant something serious? As we age, our bodies change, and certain warning signs should never be ignored. These symptoms could indicate underlying health issues that, if left unchecked, may become life-threatening. As a doctor with years of experience in senior healthcare, I have seen firsthand how these warning signs manifest and what happens when they are ignored. In this video, presented by Golden Years Balance, I will break down 6 critical symptoms that demand immediate medical attention. But more importantly, I will share personal insights, real-life cases, and expert advice that could save lives. If you or a loved one has experienced any of these symptoms, don't hesitate to consult a doctor. Your health is your greatest asset, and being informed gives you the power to take control of it. Stay with me until the end. What you learn today could change your future. Number 1, unexplained extreme fatigue. Unexplained extreme fatigue can be a deeply unsettling symptom, especially when it begins to interfere with your everyday life. It's easy to dismiss this feeling as part of the aging process or simply a result of overwork, but it's important to recognize when it becomes more than just tiredness. Overwhelming exhaustion that doesn't seem to have a clear cause should be considered a red flag. Unlike the normal fatigue we feel after physical exertion or a busy day, unexplained extreme fatigue feels persistent, all-encompassing, and often leaves you feeling drained even after a full night's sleep. In many cases, this type of fatigue may be linked to serious underlying medical conditions that need immediate attention. For instance, heart disease can lead to fatigue as the heart struggles to pump blood efficiently to the rest of the body. Kidney failure is another condition that can cause extreme tiredness because the kidneys play a vital role in filtering toxins and waste from the bloodstream. When they aren't functioning properly, waste builds up in the body, leading to fatigue. Cancer, especially in its later stages, can also lead to fatigue as the body expends energy fighting the disease. The human body has a remarkable ability to adjust to changes, but when critical organs are under stress, this can come at the cost of your energy levels. Vital organs like the heart, kidneys, and liver require a significant amount of energy to function properly. When they are struggling, the body prioritizes these essential functions, diverting energy away from less critical processes. This can result in chronic exhaustion, often without other immediately obvious symptoms. For seniors, chronic fatigue is one of the most commonly overlooked symptoms, partly because it develops gradually and can be mistaken for the general weariness that comes with aging. However, if you find that activities you once did with ease now leave you feeling drained, or if you're unable to keep up with your usual routine, it's important to take this seriously. What should you do? If you start to notice an increase in your fatigue levels, the first step is to track when it started and observe what activities make it worse. Write down your symptoms and any accompanying signs like dizziness, unexplained weight loss, or swelling in the ankles or legs. This can provide crucial information for your doctor. Pay attention to whether the fatigue is continuous or comes and goes, and if you feel better after rest, or if the exhaustion persists regardless of how much sleep you get. If your fatigue lasts longer than a few weeks, interferes with your ability to perform daily tasks, or is accompanied by any other concerning symptoms, it's time to consult a healthcare provider. A doctor will be able to perform necessary tests to determine the root cause of your fatigue and recommend an appropriate course of treatment. Early detection and treatment can make a significant difference in managing any underlying conditions, so don't wait too long before seeking medical help. Number 2. Sudden and severe chest pain or pressure. Sudden and severe chest pain or pressure should never be taken lightly. When it strikes, it often feels like a sharp crushing or squeezing sensation in the chest. Many people dismiss it as something minor like heartburn or stress, but this can be a grave mistake. Doctors emphasize that immediate action is critical, as waiting too long can lead to irreversible consequences, even death. Ignoring these symptoms, especially in the early stages, is one of the most dangerous mistakes a person can make. Chest pain may signal a number of serious conditions. The most common cause is a heart attack, which occurs when the blood flow to a part of the heart muscle becomes blocked. Aortic dissection, A tear in the wall of the major artery that carries blood from the heart is another serious condition that often causes intense chest pain. Pulmonary embolism, which happens when a blood clot blocks a lung artery, can also result in sudden chest pain. Regardless of the underlying cause, any significant chest discomfort should be treated as a medical emergency. It is easy to make the mistake of downplaying chest pain when it is mild. However, even mild discomfort should be taken seriously. The pain can often start out subtle and intensify quickly, which is why early intervention is essential. Some individuals may try to wait it out or think that the pain will subside on its own, but this approach can be fatal. By the time the pain worsens, it could already be too late to prevent severe damage or death. What should you do if you experience chest pain? First, recognize that if the pain lasts more than a few minutes, it's time to seek immediate medical help. Do not wait or attempt to tough it out. Calling emergency services should be your first step. Time is of the essence in treating heart attacks, aortic dissections, and pulmonary embolisms. If the pain spreads to your arm, jaw, or back, do not hesitate for a second. These are classic signs of a heart attack, and they indicate that your heart is in trouble. Another critical piece of advice is not to drive yourself to the hospital. While it might seem like a faster option, driving while experiencing severe chest pain is incredibly risky. You could lose consciousness or make the situation worse, potentially causing an accident. It's far safer to wait for emergency responders who are trained to provide life-saving care on the way to the hospital. In conclusion, sudden chest pain or pressure should always be treated as a medical emergency. Don't ignore it, even if the pain is mild or fleeting. Prompt medical attention can be the difference between life and death. So act quickly and responsibly when faced with this dangerous symptom. Number 3, difficulty breathing or shortness of breath. Imagine sitting comfortably in a chair, relaxing and doing nothing that requires effort, yet suddenly you feel as if you can't catch your breath. This sensation, even when you're not exerting yourself, could be a red flag that your body is in distress and needs immediate attention. Shortness of breath, also known as dyspnea, is not just a minor inconvenience. It could be a warning sign of a serious underlying condition. Several potential health issues can cause difficulty breathing, and some of them are life-threatening if not addressed promptly. One of the primary causes of shortness of breath is heart failure, where the heart becomes too weak to pump blood effectively, leading to fluid buildup in the lungs. This makes it harder for oxygen to pass through the lungs and into the bloodstream, causing a feeling of breathlessness. In other cases, lung disease, such as chronic obstructive pulmonary disease, COPD, pneumonia, or asthma, can impair lung function, making it difficult to breathe. Another critical condition to be aware of is a pulmonary embolism, a blockage in one of the pulmonary arteries in the lungs, typically caused by a blood clot. This is a medical emergency and can be fatal if not treated immediately. A heart attack can also present with shortness of breath, often accompanied by chest pain or discomfort. Interestingly, some heart attacks may occur without the typical chest pain, presenting only with difficulty breathing, dizziness, or fatigue. What should you do? If you experience sudden or unexplained shortness of breath, it's crucial to seek medical help immediately. The severity of the situation can vary, and only a healthcare professional can determine the cause and provide the necessary treatment. While waiting for medical help to arrive, try to remain as calm as possible. Panicking can make it even harder to breathe. If you feel dizzy or lightheaded, it may help to sit upright or lean forward slightly, as this can sometimes ease the pressure on your lungs and improve airflow. Another important step is to monitor for additional symptoms. Swelling in the legs, ankles, or abdomen may suggest heart failure or fluid buildup. If dizziness accompanies the shortness of breath, it could be a sign of an issue with blood circulation or a serious heart problem. Take note of any other discomforts or abnormalities in your body as you wait for medical professionals to assess your condition. Remember, difficulty breathing should never be ignored. Act quickly, but stay as calm as possible, and don't hesitate to call for emergency help. Number 4, drastic and unexplained weight loss. While it might seem like a good thing to lose weight without any effort, sudden And unexplained weight loss is often a red flag for serious underlying health conditions. If you notice that you're shedding pounds quickly and you haven't made any changes to your diet, exercise, or lifestyle, it's important not to ignore this symptom. It could be an early warning sign of a severe illness that needs immediate medical attention. Unintentional weight loss can occur due to various health conditions, ranging from chronic disease to life-threatening conditions. One of the most common causes of rapid weight loss is cancer. As the body fights off cancer, it may not be able to absorb nutrients effectively, leading to a significant loss of body mass. In some cases, the body might use more energy to fight the disease, causing weight loss. Diabetes is another condition that can lead to unexplained weight loss. When blood sugar levels are uncontrolled, the body may start to break down muscle and fat for energy, which results in weight loss. Other metabolic disorders, such as hyperthyroidism, can also contribute to sudden weight changes. With hyperthyroidism, the thyroid gland produces excess hormones that speed up the body's metabolism, causing the body to burn more calories than normal. If your body isn't absorbing nutrients properly, you could also experience muscle loss, weakness, and general frailty. This is because the body is not receiving the essential vitamins and minerals it needs to maintain healthy muscle mass. The lack of proper nutrition can lead to exhaustion, difficulty concentrating, and a general sense of being unwell. What should you do? If you notice that you've lost more than 5% of your body weight within a few months or less, it's crucial to see a doctor as soon as possible. Your physician will be able to evaluate your health and determine if there are any underlying conditions that need to be addressed. The earlier you seek medical attention, the better the chances of catching any issues early and improving your overall prognosis. In addition to weight loss, you should pay close attention to any other symptoms, such as changes in your appetite, unusual fatigue, or digestive issues like nausea, vomiting, or diarrhea. These could be additional clues to the cause of your weight loss. If your doctor doesn't offer an immediate diagnosis, or if something feels off during your visit, insist on further tests. You have the right to advocate for your health, and sometimes multiple tests are necessary to get to the root of the problem. Keep track of any changes in your body and communicate them clearly to your healthcare provider, as this information will be vital in determining the cause of the unexplained weight loss. Number 5, confusion, disorientation, or personality changes. Experiencing sudden memory issues or noticing significant changes in behavior can be a cause for concern. If you or a loved one exhibit signs of confusion, disorientation, or altered personality traits, it's crucial to seek immediate medical attention. These changes might be more than just typical signs of aging and can indicate serious underlying health problems. Sudden cognitive decline can be a warning sign of several potential health conditions, including strokes, infections, or neurological disorders such as Alzheimer's disease. It's important to recognize that while age-related memory lapses are common, abrupt, severe changes in behavior are not. If someone who has been sharp and engaged begins to forget simple things or behaves out of character, it should not be dismissed as normal aging. In many cases, these changes could signal a medical emergency that requires prompt intervention. Strokes, for example, can cause sudden confusion or trouble speaking. A stroke occurs when there is a blockage or rupture in the blood vessels in the brain, leading to brain cell damage. Memory issues or disorientation following a stroke can be severe and may result in lasting impairments. Infections such as urinary tract infections, UTIs, or pneumonia can also lead to confusion, particularly in older adults. These infections often manifest with symptoms like fever or fatigue, but they can also result in sudden changes in mental state. Neurological diseases like Alzheimer's or other forms of dementia can cause a progressive decline in cognitive function, leading to memory loss, difficulty recognizing familiar faces or places, and changes in behavior. These conditions tend to worsen over time and can significantly impact the quality of life for both the person affected and their caregivers. What should you do? If you or someone you know experiences a sudden decline in memory, changes in behavior, or confusion, do not wait. Seek medical help immediately. The faster a healthcare professional can assess the situation, the better the chances are of addressing the underlying issue before it worsens. Pay close attention to specific symptoms that might indicate a more serious condition, such as speech difficulties, trouble recognizing familiar people or locations, or disorientation about time and place. If someone appears suddenly confused or lost, especially if they have trouble recalling their surroundings or understanding simple instructions, it's time to act. Remember, time is of the essence when it comes to cognitive issues. Whether it's a stroke, infection, or an underlying neurological disorder, early intervention can make all the difference in the treatment and outcome. Every second counts, so don't hesitate to call for help. Number 6, severe and persistent abdominal pain. A critical warning. Abdominal pain that persists or intensifies should never be dismissed, as it can signal a serious life-threatening emergency. It's crucial to listen to your body and respond swiftly if the pain doesn't subside or worsens over time. Severe and prolonged abdominal pain often points to an underlying condition that requires immediate medical attention. While many types of abdominal discomfort are minor and temporary, persistent pain can be an indication of something far more dangerous. Certain conditions can cause severe abdominal pain, and many of them require urgent medical intervention. One of the most critical and potentially fatal causes of abdominal pain is a ruptured abdominal aortic aneurysm A. This occurs when the large blood vessel that supplies blood to the abdomen, legs and pelvis breaks open, causing intense pain and internal bleeding. Without quick treatment, AAA can be fatal, making it an emergency that demands immediate medical attention. Another severe condition that causes persistent abdominal pain is intestinal blockage, also known as a bowel obstruction. This can occur when there is a blockage in the intestines, either due to a tumour, scar tissue, or twisting of the bowel. When left untreated, it can lead to tissue death, infection, and potentially life-threatening complications. Pancreatitis is another serious condition that can lead to ongoing abdominal pain. It is the inflammation of the pancreas, often due to excessive alcohol use, gallstones, or high levels of cholesterol or triglycerides. Severe pancreatitis can cause long-term damage to the pancreas, kidney failure, and even death if not treated promptly. Other causes of persistent abdominal pain include appendicitis, gastrointestinal bleeding, or even peritonitis, inflammation of the peritoneum, the lining of the abdomen. All of these conditions can have fatal outcomes if not addressed quickly. What should you do? If you experience deep, sharp, or persistent abdominal pain, it is essential not to ignore it. Pain that lasts for several hours or keeps coming back can be a sign of something serious. If the pain is severe or is accompanied by other alarming symptoms, such as fever, vomiting, bloating, or swelling in the abdomen, it's time to seek medical attention immediately. Do not wait to see if the pain gets better on its own, as early detection and treatment are vital in these situations. While the pain may not always indicate a life-threatening issue, it's always better to err on the side of caution, especially when symptoms like fever or vomiting are present. Delaying treatment can lead to worsening conditions and potentially irreversible damage to vital organs. If you're uncertain about the severity of the pain, it's safer to get evaluated by a healthcare professional who can conduct tests such as blood work, imaging, or a physical examination to diagnose the issue and initiate the appropriate treatment plan. Severe and persistent abdominal pain should always be treated with urgency. While some causes may be less severe, conditions like ruptured aneurysms, intestinal blockage, and pancreatitis can have life-threatening consequences if left untreated. Don't wait for the pain to worsen. Prompt medical intervention can make a significant difference in outcomes and, in many cases, can be life-saving. Always consult with a healthcare provider when faced with unexplained and persistent abdominal pain. Your body often sends subtle signals before a health crisis occurs, and it's important to recognize them early. Symptoms like sudden fatigue, unexplained weight loss, or severe pain should never be ignored. These can be the body's way of signaling that something is wrong. If left unaddressed, they can lead to more severe health issues, even life-threatening conditions. Taking these signs seriously can make all the difference in preventing a serious medical event and staying in control of your health. Have you or someone close to you ever experienced any of these warning signs? It's essential to share our stories because they can help others identify potential health concerns early on. You never know, your experience might just be the key to someone else's awareness and timely action. If you found this video helpful and informative, please consider liking and subscribing to Golden Years Balance. Don't forget to hit the bell icon to stay updated on more health insights and practical tips. Your support is what allows us to continue producing content that helps keep everyone informed, motivated, and healthy. Above all, remember that your well-being is in your hands. Take care of yourself, listen to your body, and make your health a priority. We'll see you in the next video.